We're taking you inside a supervised injection site. This is a place where users can get free, clean needles and shoot up. Addicts do have to bring their own drugs, and they're watched as they inject. How long have you been using?
Basically, most of my life.
Though Hugh here might not fit the image of someone who uses heroin, he does. When was the last time you used?
Last night. Probably early this morning, around 4. 4 or 5 this morning.
The morning we met him, he was shooting up at the Molson Overdose Prevention Site in Vancouver, British Columbia. This is a place where he also works as a supervisor, watching others for overdoses.
I've had more than 40 overdoses.
Daniel Beaverstock started in prison.
This warm feeling went up in my body, and everything that was going on around me didn't matter anymore.
Today, he's after his next high, and it's going to come from the crystal meth that he's about to inject in his arm. Both Daniel and Carissa Sutherland have overdosed repeatedly in the past, and they say they'd use whether or not this place existed.
If it wasn't for this place or these places, I would be dead.
Yeah, me too.
It's worth noting no one has ever died in the city at a supervised injection site. Here, workers give users who overdose a drug called Narcan. It stops the immediate effects of an overdose until medical help arrives.
What we're dealing with now, really since 2014, is a massive opioid crisis, an epidemic, really.
Coco Culvertson helps manage the programs that are run at these sites.
How often in a day are you having to reverse an overdose?
It ranges from 10 to 20 to some days there are 30 overdoses at this site.
That's just a staggering number.
It's absolutely, it's terrifying.
The sites are funded with taxpayer money that's routed through the city's health department and other nonprofit groups. Each site can link users to addiction treatment programs if the user requests it. Supervised injection sites might be controversial in the United States, but here in Vancouver, there is overwhelming public support. Before these facilities opened, needles used to be all over the streets. People were using in businesses' bathrooms. Now, that has been greatly reduced. There's going to be critics that say you're just making it easier for these people to continue to use drugs.
Absolutely not. I would argue that there is nothing easy about using illicit substance. No one walks out of their door one day and decides, I'm going to try heroin and buy it illegally.
It did not lead to increased drug use.
Dr. Patricia Daly heads up Vancouver's version of the Public Health Department, and she doesn't miss a beat in her support of the supervised injection sites.
We have found that supervised injection sites don't increase drug use. And overall, there's been a reduction in injection drug use in Vancouver in the year since we've offered supervised injection services.
She links the sites and their clean needles to a drop in HIV rates in the city.
The lifetime cost of providing care to someone with HIV is astronomical.
We believe that when there's laws on the books, that you need to obey the law.
It might not surprise you that the director of a regional federal program that monitors drug trends completely disagrees.
Is it fair to say that most law enforcement is completely against this?
Absolutely. I understand from an individual standpoint where the treatment people say, well, this is for an individual, and that's what their success rate. We look at society in general and say, no, we want to stigmatize drug use because we don't want more people that you and I have to deal with. And a perfect example is tobacco. It used to be cool to smoke tobacco. It is no longer cool.
Would you like to stop?
I would. I really would like to stop.
The users we met know it's not cool. They say they're trying to beat an addiction, but it is a painful road.
I don't want people that love me hearing that I died in a piss stinking alley because I was using heroin. I don't want my daughter to hear that. I don't want that to be the image of me.